Welcome to the Galien Golden Jubilee Awards, a special celebration of 50 years of progress, recognizing the best of the best in life sciences innovation in pursuit of a healthier, better life for all. Since the first Prix Galien medal was awarded in 1970, some 525 new drugs and technologies from 15 different countries have been selected for their performance in breaking new ground in the global fight against disease. The crucial work of 88 innovative life sciences companies, many here tonight, have brought longer life to millions of patients with treatment and cures covering 17 therapeutic areas. All nominees for the Galien Medal are assessed independently by a distinguished global network of 50 top biomedical scientists, including laureates of the Nobel Prize and Prix Galien jury members past and present. Over the years, the therapeutic product areas we recognize have grown with the rapid pace of medical science, covering Best Orphan and Rare Diseases Product, Best Biotechnology Product, Best Pharmaceutical Product, Best Vaccine, and Best Medical Technology. Tonight, the moment of celebration has arrived. Please join us in congratulating the finalists. And now, the winners of the Bronze Golden Jubilee Medal are in the Orphan Rare Diseases Product category, Kaleidoco, Vertex. In the Biotechnology Product category, Humira, AbbVie. In the Pharmaceutical Product category, Augmentin, GSK. In the Vaccine, 6-in-1 Infant Vaccine, Sanofi Pasteur MSD. In the Best Medical Technology, Cobas HBV Test, Roche Diagnostics. We are excited to announce the Silver Golden Jubilee medalists. And the silver medal goes to in the Orphan Rare Diseases Product category, Spinraza, Biogen. In the Biotechnology Product category, Keytruda, Merck NC. In the Pharmaceutical Product category, Zocor, Merck NC. In Vaccine, Prevnar, Pfizer. In Medical Technology, Sapien 3, Edwards.
Now it's time to distribute tonight's highest accolade, the Jubilee Gold Medals for Best Orphan Disease Product, Biotech, Pharmaceutical, Vaccine, or Medical Device introduced in the past 50 years of medical discovery. It's a tough choice, because it's now well established that the scientific era since 1970 has been the most productive in history. But first, let's hear from the second of our young physician pioneers on what brought them to seek a career in medicine and science. Welcome, Emily Hansel, a second-year student at Columbia Vagelos Medical College.
Good evening. Thank you for inviting me to be here with you all tonight. Unlike many others in medical school, I actually did not grow up imagining that I would inhabit the world of science. I was more comfortable on stage and trained for about a decade in operatic performance. However, the shift to the medical world felt more natural than I could have imagined. Whether it's the opera house or the doctor's office, I learned that my passions both stemmed for a passion for stories. As a medical student, I have had the immense privilege of hearing many stories, from the testimonies of those fleeing persecution as a part of working with the Columbia Human Rights Initiative Asylum Clinic, to the difficulties shared by patients living in rural communities facing barriers to care due to lack of access to transportation, to countless tales of family shared by one of my favorite patients who, at the end of every encounter, would tell me in the medical care team, "I like you and I love you." This year I've decided to spend an entire year conducting research because I see this as the best way to contribute to the stories of my future patients. By conducting basic research in laryngology, I hope that discoveries made under the microscope might one day contribute to helping the lives of those patients who present to clinic with difficulty speaking. I am so honored to be in this room tonight with all of these with all the leaders of scientific innovation who are actively working to change the story of science. Congratulations to all honored tonight, and thank you.
Well, let's go right to the envelopes. I know dinner awaits. Don't worry, I'm experienced at this. I do want to say first that all innovations on display tonight deserve our respect. There are no losers here. Selections were made by the 50 members of the Prix Galien Awards Committee worldwide, distinguished scientists, all whose only incentive was to select the best. All these products have withstood the test of time for 50 years. Generations of patients do not lie. With that, this is more nerve-wracking than the Oscars. With that, I am pleased to announce our first gold medal for excellence in orphan and rare disease is Kymria Novartis. Next, for excellence in biotech, the gold is Herceptin, Roche. The gold medal for medicines, for pharmaceuticals, is Gleevec, Novartis. The gold for vaccines goes to Gardalsis and Gardalsis 9, Merck and C. And finally, in medical devices and technologies, the gold medal goes to Freestyle Libre, Abbott. Congratulations to you all. Now, may I ask the 5 of you to join me here on stage? I have to say, this really is more exciting than the Oscars. You know, it's one thing to make a movie, to keep people feeling their joy and joining us in our compassion and empathy. It's another thing to save people's lives. Very, very proud to be here and witness this. Let's give another hearty round of applause to your medal winners for the last 50 years in medicine.